Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, December 21st, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, good afternoon. Today, Premier Ford announced a province-wide lockdown that will take effect on Boxing Day. This later effective date is less relevant to our city, as Toronto is already in a lockdown based on public health advice, although the new 28-day lockdown will go further. Public health officials have been clear that this kind of hard lockdown is needed to stop the spread of COVID-19. This kind of strong stand against the virus is needed to save lives and to protect the health of each and every one of the residents of our city and of our province. I support Premier Ford's decision, and I thank him and his cabinet and his caucus for making the difficult but absolutely necessary decision that they made today. It quite properly places protection of health, the saving of lives, and the protection of our healthcare system at the very top of our priority list as a province and as people. Our message now, more than ever, is please stay home as much as possible. Only have in-person Christmas and New Year's celebrations with the people you live with, and help us all stop COVID-19 from overwhelming our healthcare system and putting not only our lives at risk, but putting the lives of our frontline heroes at risk in the healthcare system. I've said many times that COVID-19 has been the greatest challenge our generation has ever faced, and I think that that's a fair statement. This moment, the next 4 weeks, will be the ultimate test of our ability to collectively do the right thing and stop the spread of this virus and all that that carries with it in terms of tragedy and dislocation for many. The threat we are facing is very real and, as provincial officials outlined today, could overwhelm our hospitals in the coming weeks. The virus doesn't care about age or about health or municipal boundaries. Action is needed now in order to get our numbers across the province back on track. As Dr. de Villa will tell you today, and these things bear repeating so that people can really focus on them, the youngest person hospitalized due to COVID-19 in the last 24 hours was 11 years old. So when we've been telling you that one of the fastest age groups in which COVID-19 has been growing is that group between, I think it's 4 and 17 years of age, you might wonder, well, you know, what does that really matter? Nobody's going to be in hospital or nobody's going to really get too sick as a result of that. Yet we have an 11-year-old in the hospital. The youngest person to tragically pass away in the last day, right here in the City of Toronto, was 30 years old. Imagine losing a loved one anytime, but imagine losing a loved one in the week before Christmas or worrying about your child in the hospital over the holidays because of this terrible virus. And let's not overlook the fact that, left unchecked, this virus could make it impossible for you or a loved one to receive proper care should you fall ill with a stroke or a heart attack or be involved in some kind of a mishap over the holidays. The strain on the system could then make it impossible for you to get proper care in that instance. We must not let ourselves get to that point. And let's be honest, that is where we are absolutely headed, absent tough medicine like this. This afternoon, I met with the Greater Toronto and Hamilton area mayors and chairs who represent the 11 largest municipal governments across our region. While there are differing circumstances which prevail in different parts of the region, the mayors and chairs are united in supporting the province and working together to protect health, to protect the healthcare system, and to protect our way of life, including the economy and business. The mayors and chairs continue to urge the provincial and federal governments to provide proper sick leave benefits for employees who test positive, as well as providing for increased workplace inspections to ensure public health compliance. There are still far too many workers going to work sick and being hesitant about getting tested for fear of losing their paychecks, and this is not an acceptable ongoing situation. The mayors and chairs also recognize these additional health measures undertaken today will further impact businesses, especially smaller businesses, which are vital to the well-being of all of our local economies. We believe it is urgent that the additional supports referenced today, and perhaps even more than that, be made available to these small businesses immediately and that greater attention should be paid to promoting the availability of existing programs for which there has been very little in the way of uptake so far. The Premier said today that Finance Minister Rod Phillips will be reviewing existing support programs to help businesses, and the government will also be providing grants to small business owners. That help and those reviews must be done quickly, as I'm sure will be the case. Deputy Premier Christine Elliott, also the Health Minister, confirmed today that the government will be providing support to high-priority communities in Toronto and other cities where COVID-19 has had a more devastating impact. We moved to create our TO supports program that helps neighbourhoods that are being hardest hit by COVID-19. This includes ramping up testing and access to testing in these communities. It's why we now have pop-up testing facilities in city sites, and we have mobile testing on decommissioned TTC buses, increasing outreach and engagement to people and providing wraparound supports for people who have tested for COVID but need help isolating. Again, I commend the Premier and the Minister for confirming this important help for those neighbourhoods and people hardest hit by COVID-19. This is the right thing to do, it's a timely thing to do, and I'm glad that other cities across the province will have the opportunity to replicate some of the things Toronto has initiated to help those people. This funding will help those efforts that we have underway in the City of Toronto. I know many people are tired of the public health restrictions, and many believe they've been following them to the letter, and that they're mad seeing others ignoring the rules. For the life of me, I cannot understand why a group of grown adults would, for example, completely ignore the very reasonable rules and hours of operation of our rinks and show up late at night to play shinny hockey when the shinny hockey itself is not permitted under the rules, and when the opening and closing hours of these rinks are very reasonable, the same as they were in past years, and are meant to give the staff a break and to make sure that things can be properly supervised at a time when we have some rules designed to protect the health of those very same people. I can't understand why those basic rules can't be followed, and yet we have adults showing up to do that late at night, and then in some cases giving the staff a very hard time when they're reminded of these rules. I don't know why they want to do it, but I don't understand why now, above and beyond everything else. I know why people want to play shinny hockey, but why do they have to do this now when it has been determined, based on the best advice we can get from our doctor, that this is not good for public health and stopping the spread of this virus, and it certainly isn't good after hours on these rinks? Why did people have the big social gatherings the police had to visit over the weekend? Why did they have to have those social gatherings, and why did people attend them in fairly large numbers? We all need to commit ourselves to follow these rules and guidelines now. Now, it doesn't really matter, it never did matter what day different lockdowns were declared. It just matters that we decide to follow the advice that's been given for weeks on end. We need to repeat the solid compliance that we saw in the spring. If you think back, people really did cooperate at that time, and if you think back, the results showed for that. When we endured some weeks of sacrifice, the numbers got better and better as time went on. We have proven before that we can do this. We can do this. Please stay at home as much as possible. Please wear a mask whenever you go out. Please wash your hands, and please get tested if you have any COVID-19 symptoms, and make sure that you isolate yourself from others. Again, I thank Premier Ford and his government for their leadership. With these measures and our accepting collectively of a degree of personal responsibility, we can get through to the day when we can get vaccinated and really start to put this nightmare behind us. I'd now like to ask Dr. de Villa to offer her report for today.
Thank you, Mayor Tory, and good afternoon. Difficult circumstances require difficult measures. What is being asked of all of us is necessary, today and in the days and weeks ahead. I urge everyone to act immediately to protect yourselves against COVID-19. We cannot wish away COVID-19. We cannot ignore it. We cannot pretend or hope that somehow we'll be safe while it infects somebody else. COVID-19 is surging dangerously here and all over the world. It will only get worse without action. Today, I am reporting 646 new cases of COVID-19 in Toronto. 300 people are in hospital, and 86 people are in the ICU. Sadly, I am also reporting 9 deaths. Amongst these reports, the youngest of those who've died was 30 years old, and the youngest person in hospital is 11 years old. In the last 7 days, we've reported just over 5,050 cases of COVID-19 in Toronto, bringing us to just over 54,000 cases since the pandemic began. There's a lot of concern today about the new strain of virus that is thought to be prevalent in the United Kingdom. It's a risk worth managing carefully, and as we've seen in the response, this includes acting with caution and preemptively. Given where we are in the pandemic, this is a logical course of action. For those feeling anxious about the situation, I would urge you to remember that viruses are constantly evolving and that there is much yet to be understood about this on a scientific basis. Mostly, my advice is to not let it discourage you, but to use it instead to strengthen your resolve. Whatever science may determine this development represents, it is a reminder that COVID-19 spreads really, really easily, and we ignore that at our peril. I don't think any of us would be around someone we knew to have COVID-19 if we had the choice. So this suggests that people are getting it in some instances from people who don't know that they have it. COVID-19 is a true opportunist. Given the right circumstances, it infects people easily. Identifying the right circumstances is simple. When we're together, especially indoors, too physically close for too long, around someone who may or may not know that they're infected. When our guard is down, when we're relaxed, when we're with people we're used to. Those who can keep apart must. While there will be some people who have to have contact with others, I encourage everyone who is able to stay apart to do just that. It's disappointing that COVID-19 has worsened so dangerously during the holidays. But trouble doesn't care what day it is. It strikes when it strikes. COVID-19 has gathered steam. The best we can do is to cut it off. That requires us to keep apart at every opportunity. But being apart does not have to mean being completely alone. Use the means at your disposal, your computer or your phone, to reach out over the holidays. And when you connect, take credit for the choice to keep apart this year. You have every right to say to one another, I wish we didn't have to do this, but I'm glad we did. In uniting against COVID-19 this one time, we are paving the way both to the best of the past and toward the future as we know it should be. To have both, at present, we have to make the best of the situation as it is. Someone said to me the other day, if you love your family or your friends so much that you can't spend one Christmas without them, surely it means that you love them enough to spend this Christmas apart. With that, I'll now hand it over to Chief Pegg to deliver his remarks for today.
Thank you, Dr. de Villa, and good afternoon. Saving lives and preventing the spread of COVID-19 and doing all we can to prevent our healthcare system from becoming overwhelmed have been our top priorities since the outset of this global pandemic. With those goals in mind, our coordinated enforcement teams have been working diligently to enforce the regulations relating to COVID-19. The city has taken formal enforcement action 1,744 times to date. This weekend, our enforcement officers continued to monitor compliance with the Reopening Ontario Act. 216 bars and restaurants were inspected, resulting in a 99% compliance rate. 2 charges were laid as a result of violations of the Act. Our officers also laid 8 charges against non-essential businesses as a result of operating in violation of the Act. I'm pleased to report that our enforcement teams did not observe any violations during shopping mall patrols, where only essential businesses are permitted to be open. I want to thank the vast majority of residents and businesses who continue to help stop the spread of COVID-19 in our city. Over the course of the weekend, 25 charges were laid as a result of the investigation of complaints relating to large gatherings at various venues, including a bar and lounge, an industrial unit, and on private property. Toronto Police also responded to a number of protests and rallies over the course of the weekend. This included a rally in downtown Toronto, a pop-up protest that overtook an intersection in 14 Division, a protest in Yonge Dundas Square, and a protest at Queen's Park. Toronto Police also responded to an anti-mask Santa Claus-themed rally in downtown Toronto. 3 charges have been laid against the organizers of these protests and rallies, and the investigation into these protests and rallies remains ongoing by police. Penalties associated with being convicted of an offence under the Reopening Ontario Act are as high as $100,000 for an individual, $500,000 for a director or officer of a corporation, and up to $10 million for a corporation. Jail time is also possible for individuals. On the 28th of November, 54 of the city's outdoor skating rinks opened, with new operational guidelines in place that reduce the risks associated with spreading COVID-19. These safety provisions include a maximum of 25 skaters per ice pad, a reservation system to allow for contact tracing if necessary, and no shinny or hockey play being permitted. Outdoor rinks are open from 10 a.m. through 10 p.m. daily, with a maximum of 25 people on the ice surface at any one time, and subject to outdoor skating reservations being made in advance. Attempting to access and/or use outdoor rinks outside normal operating hours is both illegal and dangerous. Generally, usage has been in compliance with COVID-19 guidelines and requirements. However, this weekend we experienced and responded to a number of issues that included unauthorized after-hours usage, shinny hockey play, exceeding the capacity limits on the ice, open alcohol, groups loitering off the ice, insufficient physical distancing, not wearing masks, skaters not wanting to register or provide the required contact tracing information, and damage to property when accessing ice after hours. I'm very disappointed to report that a number of city staff were subjected to threatening behavior when asking patrons to comply with guidelines and when attempting to restrict access to ice during after-hours periods. Toronto police officers were engaged and assisted in dealing with issues at 6 outdoor rinks and also provided enhanced patrols at a further 7 outdoor rink locations. These efforts were augmented by both municipal law enforcement officers and corporate security, who responded to assist our parks, forestry, and recreation staff in addressing the issues that arose. Amidst all of the difficulty and challenges associated with the restrictions that have been put in place in response to COVID-19, it is important to remember that work is happening around the clock to make vaccines available as very soon as possible. The dedicated women and men who are assigned to our immunization task force are working tirelessly, ensuring that we are ready to launch vaccine administration in Toronto as very soon as vaccines are made available by the province of Ontario. Our city teams are directly connected to the teams being led by General Hillier and will continue this important work over the upcoming holidays. In a recent meeting with General Hillier, he described the work being done to procure, supply, and administer COVID-19 vaccines as the bright light in the battle against COVID-19. I hope that we can all both take comfort and find a renewed sense of hope as the COVID-19 vaccine programs continue to roll out. We will get through this and back to the thriving, vibrant, and exciting city that we all crave so badly. Thank you.
Thank you, Chief Pegg. Before we go to questions, just a reminder to reporters to please unmute yourself when called upon to ask a question, and we'll go first to Mark McAllister from City News. Mark, go ahead, please.
Thank you, Brad. Dr. de Villa, I'd like to start with you. Back in November 10th specifically, you took the time to use your authority to go above and beyond what the province had announced in terms of restrictions. Why would you not do that today when we know that more needs to be done?
You know, Mark, I think that what we have seen are steps towards the necessary actions that need to be taken. We know what makes a difference in respect of COVID-19 spread throughout our city and in cities all over the world. And in fact, we've seen similar actions taken all over the world. And you'll also hear from public health officials all over the world that what is necessary is for individuals to actually take this very seriously. Governments can do what they will do. Fundamentally, what it comes down to, though, is the behavior that each and every one of us undertakes, particularly those of us who have the freedom and the luxury to be able to do such things as work from home, where we don't have to go to essential workplaces or go to a healthcare workplace to engage in our daily jobs and what have you. So we know what needs to be done. And I would encourage, as I have for many weeks now, and I will continue to do so, to encourage the people of Toronto to please limit their action and interaction with others outside of their homes to the greatest extent possible. Really focus on having close contact only with those people with whom you share a roof, right? That's really fundamentally what needs to happen here. If you need to go outside for those essentials like groceries or you know, pharmaceutical products or some exercise, you know, wear a mask as much as possible and keep your distance. Wash your hands. All of these things are the actions that each and every one of us needs to take in order to best control and limit the spread of COVID-19, knowing that we've got vaccines coming up, you know, very rapidly, and that will help us as part of that which is in our toolkit to help fight COVID-19.
Perhaps, Mayor Tory, you could follow up on that and provide your thoughts on it as well. Beyond that, the province's announcement today was quite confusing from a Toronto perspective, and you yourself, in your very opening remark, said not much really changes from a Toronto perspective. What changes here in this city?
It's not entirely clear yet what will change, in that I think the lists of businesses that are deemed essential and not, and therefore open and closed, has not yet been finalized. We haven't seen it. And so I think the changes that are likely to be most affecting of people will be that kind of change. But we're in a lockdown already. And so I think that now what really falls to people is to engage in the kind of personal behavior that builds on that to create the kind of environment in which we can deal with COVID-19. You know, people look to government sometimes for leadership, and other times they say they want the government to stay out of their lives. And of course, we've seen that playing itself out during this. Today, the government of Ontario, urged on by our medical officer of health and by me and others, has taken some very concrete action to have a lockdown that is regional. It's provincial, actually, but it certainly is going to cover all of this region. It takes some additional steps to tighten things down. And I think now the onus maybe switches to people, to say that we are going to take what the government has put in place, like it or not, and we're going to consider our neighbors, consider our co-workers, consider our own families, and stay home. I think that's where we're at. You know, I think you could have a much longer list of all kinds of other things the government could do, but unless people go the next step now and say they're going to, and most have been, but I think everybody's got to sign on for this now, and it's a good time to be doing it. It's a quieter time, and we should accept our personal responsibility, all of us, and I think if we do, we wear the masks, we stay home, we don't socialize with people we don't live with, we will see a significant improvement in this whole situation by January, and we will see the healthcare system that is on the brink come back from the brink, and that's where we want it to be, way back from that brink.
All right, thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead.
Hi, good afternoon. Dr. de Villa, I just have a question for you here. You were talking about the actions that individual people can take and how a lot is up to them, but there's a lot being made of the fact that the province hasn't made any restrictions to certain workplaces where people don't have that kind of control. And you do have the power to address those. And I'm wondering if you will step in where workplaces are a concern.
So, Matt, as you've seen throughout the course of the pandemic, we at Public Health, and in Toronto Public Health in particular, have always taken our actions premised on what the assessment of the situation is. And I think you can continue to count on us to do exactly that. As the Mayor indicated, we have yet to see the details of the new regulations and what exactly the new form of lockdown looks like, the stronger lockdown that's being called for at this point. Once we have the opportunity to review and once we have the opportunity to take a good assessment as to what's happening here in our city and to consider what's most needed in order to best support the ability of people throughout Toronto, employers and employees alike, regardless of what sector we're talking about, let's look at what actions are best needed to support the right behaviors in order that we can control COVID-19 and reduce its spread to the greatest extent possible in our city. So we've always done that in the past. It is responsible public health practice to examine the situation and make decisions premised on what we actually see and change course, of course, as needed, when the situation changes. We've always done that in the past. We'll continue to do that in the future.
Brad. I'd just like to add a word on that. It was no accident that the GTA mayors and chairs, when meeting today, the GTHA, raised this particular issue. And the province has put some more resources into more workplace compliance inspections, but we suggested there needs to be more done still beyond that. There are these stories, incredible stories, of people being told when they come to work with symptoms, just put on a second mask and, get back to work. And then there was the other issue we raised at the same time, which is the issue of sick benefits, sick pay benefits, which continues to really go largely unaddressed. And so I think these are things that are very, very important to the health and well-being of people, and ultimately it will cause more people to get tested without fear of losing their paycheck. And so I think safe workplaces are something that has to be a real area of focus.
Thank you. And actually, Mayor, I just wanted to follow up on the sick pay. Do you, I did listen to Minister Elliott talking about this and did not hear a mention about paid sick leave or an extension to that. And I'm wondering if both you and Dr. de Villa think that the areas of our city with these large clusters of cases, if they can overcome the crisis that they're dealing with without that being addressed.
Well, they can overcome the crisis of COVID-19, but the fact is that they may not be able to overcome it without serious sacrifice being made, and in fact sacrifices of people's health. The fact is what we're talking about here is the reassurance and the confidence people need in order to go get tested that they are not going to lose their paycheck if they test positive. There's a lot of us that don't have to worry about that, in different circumstances, but a lot of these people in these kinds of jobs do have to worry about that in precarious employment. And so I think that if you want to really get to the root of this in these areas where we have very high levels of positivity, then the answer is somebody has to step up. And there are different alternatives. You could say it's all the Fed's responsibility and should fall under some modified unemployment insurance benefit, which is the position sometimes being taken by the province now, and or the province should step up, or that nobody does anything. In which case you still have these people who are insecure about going to get tested, and that is a real problem that will postpone the day on which we can help those neighborhoods to get out of the very deep hole that they're in terms of the positivity rates and people going home sick and going to work sick. It's just not acceptable.
So I think if I can add to that, given the importance of such measures and protections in order to allow us and to help us better control COVID-19 within the city and to reduce its spread. You'll have noted, Matt, I'm sure, that we've had this discussion on a number of occasions at the Board of Health, and in fact, we've had motions put forth by the board. So we are very much seized of this issue and will continue to engage in important discussions to help our, the various government partners that we have and that we collaborate with to appreciate and understand that these are the kinds of protections that are actually very important, not only from a COVID-19 perspective, but arguably from other health perspectives as well.
Okay, thank you. We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead. Dave, you'll need to unmute yourself. Dave Ryder, you there? Okay, we'll come back to you, Dave. We'll, oh, no, there you go. Go ahead, Dave.
Hi, sorry. Yeah, sorry, I wouldn't unmute. Hi, thanks for this. Question, I guess, to both is, I think I'm not probably the only one struggling with reconciling what we heard last week with what we're hearing today. Last week it was urgent. We're facing this terrible January, February. We need a significant tightening of the lockdown, or we're in real trouble. And then today we're hearing, well, we don't know if what the Premier announced actually changes anything. We're not doing any more orders, and it's really up to personal responsibility, which is something you've been saying for months without any sort of noticeable impact. Can you square that circle for me?
Well, why don't I start off, David? I did not actually say that I wouldn't do orders. I said that we actually have yet to see what the specific new terms are. Haven't seen the specifics of the regulations. So very difficult to determine, what actions, if any, are necessary without knowing what the actual circumstance is. So I would suggest that the wisest course of action is to understand what is being proposed, what the specifics of that look like, and then make determinations as to what can be done from a local public health perspective. But regardless, right, governments can do what they can to create conditions to support good behaviors and the right behaviors, the healthy behaviors in the context of COVID-19. But at the end of the day, it still is about behaviors. And so to the extent that there are many of us in the city who actually have quite a bit of latitude around choice and can make very clear choices that will actually support our ability as a city and as a community to reduce the spread of COVID-19, I think what you're hearing is we're simply asking people to exercise that choice, to make the right choice at this time so that we can have the kind of future that we would like for our city sooner rather than later.
I think if you look at what we know to date, and I think we're all trying to be careful before we've actually seen the list and the actual regulations, which we'll see quite shortly, they have made a move on schools, which wasn't in place before for the January period. They have indicated some likelihood, even in the materials available now, that there's going to be some change to the essential businesses list, which will further tighten things down. They have taken a province-wide lockdown. We were calling for something to be region-wide, which it wasn't before today. Now it's province-wide, affecting all the regions within any reasonable distance of the GTHA, which was our principal concern. And they've indicated some changes that are coming to retail. I'm not sure they're enough, but I think there are some changes coming to retail itself. And so I think we need to see these details, but I think there's no question this goes further in a number of the respects I've mentioned and probably more. And now it is, I think, over to personal behavior to try and take us the rest of the way there to make the difference in the numbers that I think this can make.
Okay, I'll just ask the follow-up then. Mayor Tory, you had given specific requests to the province for changes, and you had asked Dr. de Villa to have contingency plans ready. Is there anything that you asked for or that you asked to have a plan ready that is not, that definitely is not covered by the province based on what the Premier said today and what you've heard from them?
Let's be clear on what we've seen, David, and I say this very respectfully. We've seen a deck that goes through some of the explanations in summary form of what has been announced today, and it's to be followed by what we pay close attention to, which is the actual regulations and the actual long lists of essential and non-essential businesses and all those kinds of things. And you can be sure that we will be having meetings in the next day or two to look at that detail as it emerges from the province. And based on the advice that we'll receive from Dr. de Villa, we will take whatever action we deem is in the best interest of public health. But I think that the province today, by doing some of the things that I just outlined, including a pause for the schools in January, including a province-wide lockdown, which is beyond the regional lockdown that we emphasized would be helpful, including some suggested amendments to the essential, non-essential list so as to have more places, quite frankly, closed, and some changes to retail that have been made, that is something that we should digest that and understand that completely before we try to answer your question.
Okay, final question is to Jennifer Pagliaro from the Toronto Star. Jen, go ahead.
Hey there, sorry, the mute button's struggling today. I just wanted to follow up on what Dave said, and I don't mean to pile on to have all the star questions at the end, but I'm also just struggling to understand, I respect the fact that you have to look at the actual wording of the regulations, especially in a situation where, for example, when the lockdown measures were first imposed for Toronto, but it seems pretty obvious to me that very little has changed for Toronto, just looking at the plain wording. And so while there may be inconsistencies in the actual wording of the legislation, I think it's fair to say that nothing really has changed in what the province has announced today for the residents of this city. And given what we heard this morning from provincial experts about the need for harder restrictions and what you yourselves have said before, I'm struggling to understand why you aren't here today in front of us saying that there is need for something else. And if you were to come back with that later, I understand. But what I'm hearing from you today is that this might be all we need and that we should all just continue to be vigilant.
I'll just tell you that's not what we're saying, is that this is it and you should just all relax. We're saying that maybe this foundation of increased lockdown, and there's no question, I just mentioned 3 or 4 things that have changed, that this foundation of increased lockdown brought forward by the provincial government should now be accompanied by a change in personal behavior that people undertake on their own. And frankly, if people, everybody, most people are, complying with the rules, to an extent or another, but if everybody complied with the rules absolutely in terms of the basic things we've talked about, stay home, don't socialize with people you don't live with, wear a mask, wash your hands, avoid crowd scenes, and so on, there'd be a need for far less in the way of government intervention. So I just think it's fair for us, it's perfectly fair for us to say we want to see the details of what they've announced today. You didn't hear Dr. de Villa or me, and she'll speak for herself, but saying that what was announced today meant nothing else would definitely have to happen. And I think for all of us to continue to encourage people to change their personal behavior is a perfectly fair request that we have been making. And as evidenced by some of the examples Chief Pegg talked about today and me, that message hasn't got home to some people yet. And so I just think that we will take the time in an announcement that was made about an hour ago to digest this and to see what is in the best interest of the people of the City of Toronto. And I will certainly be guided, of course, as I have been all the way through, by the advice of our Medical Officer of Health in that respect.
So Jen, if I can just add a little bit further, I would say this. It is responsible public health practice to actually assess what is in front of us. What are the actual circumstances? What are the regulations? And what are the specifics that we're looking at in order to understand what might be their potential impact and what further might be needed once we actually have that opportunity to assess those details. I think that's the kind of very reasoned and rational approach that we have provided to the residents of Toronto throughout the course of the entire pandemic. That's an obligation we undertake to the residents of Toronto. We take that very seriously. And I would, just inform the residents of Toronto that they can continue to count on us to provide them with very, reasoned, rational advice that takes into consideration the best available science, the experiences that we have had ourselves in managing the COVID response, and the experiences from other jurisdictions, and put that all together in the context of our local data to provide the best possible advice to protect the health of the most number of Toronto residents in the most efficient and quickest way possible, given what we understand of how COVID-19 spreads.
And I guess just to follow up, the province's public health experts this morning spoke about the examples of in other jurisdictions, including in Victoria, and there were quite strict restrictions, and then even stricter regulations in Melbourne city centre. So I just wonder if, in giving that example, they were trying to say that harder restrictions were needed. And that includes things Dr. Brown said, like curfews, further workplace restrictions. I know Matt asked you about workplaces, and Mayor Tory, I know you spoke about curfews this morning, but I just wonder if those are things worth considering as you review these regulations.
So, Jen, we have had the opportunity at Toronto Public Health, and I believe other public health partners all around the province have also had the opportunity to look at some of the evidence on things like curfew and what have you. I would also note that Dr. Brown in his presentation also spoke about other jurisdictions that went to specific measures around lockdown, but did so at a much later point than where we are currently here in Ontario and in Toronto in particular. So I think that these are the kinds of things that we're constantly looking at and constantly assessing and making determinations on, what benefit might further measures or different measures provide here in the city of Toronto. But fundamentally, what it does come down to is reducing social interaction between people and really focusing on staying home as much as possible. That's just another way of saying, listen, limit your social interactions basically to the people with whom you share a roof, the people with whom you live. The more we are able to do that, the more we are able to restrict our activities such that we are only going out for the most essential of reasons. And when we go out, that we're wearing a mask and watching distance and really washing our hands and doing all the self-protection measures that we've talked about for months now. The more we are all able to do that, the sooner we will be able to limit the spread of COVID-19, and the better able we will be to allow for vaccines to have the greatest effect and benefit for us as a community. So that's what it fundamentally comes down to.
Okay, thank you, Doctor. Thank you for joining us. That concludes today's briefing. The next is scheduled for Wednesday at 10 a.m. Should that change, we'll, of course, let you know. Stay well. Thank you.